Welcome back. October marks the beginning of Breast Cancer Awareness Month. Joining us for an in-depth discussion on the disease is nurse practitioner from Montefiore Einstein Cancer Center, Macheline Dupont. Ms. Dupont, thank you for joining us.
Yes, thank you for having me.
So let's jump right into it. It's Breast Cancer Awareness Month, and according to the American Cancer Society, breast cancer is one of the most common cancers in American women. Can you first explain what happens to your body when you have breast cancer?
So, breast cancer starts off very small as kind of small cellular changes. So, picture your cells as like Lego blocks that just follow a pattern and build normally stacking one on top of another. When you have breast cancer, the blocks start to change and they start to change shape. And a lot of times our bodies can, get rid of those cells that grow in an abnormal pattern. But when it can't, it proceeds to become malignant, to become cancer. And it can be at different stages in the breast. Sometimes it can be in the lobules, it can be in the ducts. But when it leaves the lobules and the ducts of the breast, it becomes invasive cancer. So it's invasive in the sense that it's left the borders of your breast tissue and started to spread.
So, are there any lifestyle factors or habits as well as inherited genes that can affect breast cancer risk?
Inherited genes definitely contribute to breast cancer. If you have a strong family history of breast or ovarian cancer, you should definitely mention that to your provider so that we can start screening you earlier. Um, Typically, we consider first degree relatives, mothers, sisters, um, aunts, grandmothers, as those to pay attention to if to consider yourself at increased risk of breast cancer. You can also just do lifestyle modifications just to be as healthy as possible. Reduce your weight, limit your sugar intake, limit excess alcohol. Just try to be as healthy as possible.
Now, according to the CDC, despite improvements in early detection and treatment for breast cancer, Black women continue to have the highest breast cancer mortality rate. Can you explain why we see these disparities in so many health issues amongst African Americans?
Yes, so there's tons of factors as to why African American women and just women of color in general, tend to suffer from breast cancer and have a higher mortality rate. Tends to come from socioeconomic status. So I've seen patients in the office that perhaps are the sole provider for their family and can't afford to take a day off of work. So they'll just let a breast mass just grow and grow and grow. And considering most breast masses for breast cancer are not painful, they just don't seek treatment until the cancer is pretty advanced. So that's one aspect of it. Then we can't take away the impact that slavery has had on um, African American and people of color's health in general. We tend to have a distrust of healthcare. So where other um, nationalities may run to the doctor whenever they have an issue or concern, we tend to seek other therapies or seek other treatments, or you know um, would prefer to um, turn to religion, as I've seen. And God is not going to let this you know cancer advance and that kind of stuff. So it's definitely a challenge, but I think that that's starting to change a little bit more, where women of color are considering seeking treatment earlier and having a little bit more faith in in science than they had prior.
Now, according to Montefiore findings, breast cancer has increased in the Bronx and New York City, and the incident rate is highest amongst those who are 70 to 74 years old. Can you just elaborate on this a little bit more?
Right. I believe that after 65 years old, a lot of women don't necessarily screen for breast cancer anymore. Maybe it's not recommended by their primary doctors. So that's why they just stop getting mammograms. And when they do have any breast imaging, it might be because they felt a lump. So that could be part of it as well. And then there's also just the process of getting older. Like I said, cancer cells are cells that grow abnormally. And when you're younger, your body can kind of catch and stop some of these malignant cells from taking over. But as you get older, that process seems to be less efficient.
You also found that the mortality rate is highest amongst non-Hispanic white women and Black women. Do you know why that is? And could economic background affect that?
Definitely. As I mentioned before, um, if you're still working and you can't get the time off to go to the doctor or to seek imaging, you don't have those connections readily available, or if it takes a long time when you're at the doctor before you're seen, all of those factors play a role in whether or not women seek treatment. And a lot of times, like I mentioned, cancer is not necessarily painful. So if you don't examine yourself and you don't go to the doctor regularly to get a breast exam, your disease is going to be found at a later stage.
So, the American Cancer Society also reports since 2007, breast cancer death rates have been steady in women younger than 50. What age do you typically suggest women begin looking for the signs and symptoms?
As early as in your 30s and 40s, you should start looking for signs and symptoms. I recommend that when you take a shower, the best way to examine yourself is with your arm up. This way, you pull all the tissue back and you can really feel anything that's lying underneath. So, arms up and palpate and like feel around with your fingers flat. So don't grab the tissue, because if you grab the tissue, everyone has a lump, right? You're going to get nervous. But if you palpate it with your fingers flat and just feel around for any lumps, believe me, you don't have to grab the tissue to feel anything. If you have something, you'll feel it with your hands flat. And just do that on a regular basis. And get to know your breast, get to know what's normal for you, what's not normal for you. That's the best way to really be able to catch something early.
So I love that you kind of walked us through, what to look for, because I have heard that we can do that at home. But I've also read that most breast lumps are benign and actually not a cancer. So we don't want anyone being freaked out, like you mentioned. Can you just elaborate what that actually means?
So yes, a lot of the times, if you're feeling something in the shower when you're in your 20s and 30s, it tends to be benign breast lumps. They tend to be painful. So benign is like not cancerous. So we can have a cyst in our breast. Cysts are just fluid-filled sacs. And you can have cysts in your breast, you can have them in your liver, your kidneys, and ovaries. Those tend to be benign. Okay. You can also have solid tumors in your breast that are benign, like fibroadenomas, especially when you're young. Um, those feel more solid. Those can be more painful when you have your period and when you have your menses. So and they can change in size based on where you are on your cycle, and both of them, the cyst and the fibroadenomas. So it's very true that when you examine yourself, you may be feeling something benign, but on the odds that you're not, you know, it's more important to be on the safe side, just to get it checked out, know what it is, get an ultrasound, get a mammogram, get it confirmed that it's not anything cancerous.
So I love that you mentioned that. And that kind of leads me into this next question where, discussions with doctors on health can be very intimidating for some people, especially when you include the possibility of cancer. It can be frightening for some. What advice do you have for those who are afraid to basically just take that first step?
Um, the best advice is to consider your pros and cons, right? an uncomfortable conversation versus actually having a malignant disease is quite a difference, right? It's quite an extreme. So if you are uncomfortable talking to your provider, I suggest that you find one that you are comfortable speaking with, because it doesn't make sense for you to put your health in the hands of someone that you don't feel comfortable talking to. So if there's a provider that you are not comfortable with, find one that you are comfortable with, let them know all of your concerns. And most providers really want to help you, right? They don't want to dismiss you. They don't want to say that what you're telling them doesn't make sense. They will refer you to specialists. They will refer you to for imaging or for testing to make sure that you feel confident about your health moving forward.
And then can you just explain what options are available to those who suspect that they have breast cancer? And can you tell us about Montefiore's screening efforts for breast cancer?
So if you suspect breast cancer because you have a strong family history of breast cancer, or because you actually feel a lump and you don't know what it is, you should reach out to your primary provider and get referral for imaging and possibly to see a specialist. Montefiore is working on getting screening mammograms for people of color, people in our community in the Bronx. Since COVID happened, a lot of people stayed away from doctors. So we're reaching back out to the community to make sure that women are being screened. So we have a breast cancer and cervical cancer screening event on Saturday, October 9th, 9 a.m. to 1 p.m. You don't have to have insurance. Because I know not having insurance is a deterrent. So you don't have to have insurance, but you do need to make an appointment. So Saturday, October 9th, between 9 and 1, we have the information and the phone number to register for the event listed below. The last time we did the event, it was back in 2019. We screened about close to 70 women. We did over 50 mammograms, and we actually did some biopsies on site. So if you don't have insurance and you have a lump, this is the perfect event for you to register, because if we do suspect that it is cancerous or it's something that should be checked out, we can biopsy it on the spot.
Ms. Dupont, thank you so much for joining us.
Thank you. Thanks again for having me.
We'll be right back with more Open BXRX Tuesday.